last but certainly not least for today is Thipiga Sivayoganathan. And you can give your policy presentation when you're ready.
Okay, thank you so much for that introduction. I want to say thank you, Grant, for pronouncing my name right. So hi, everyone. I examine trends in mental health service use, including any mental health service contact and types of providers access based on provider availability among youth and emerging adults aged 12 to 24 in Canada. I conducted secondary data analysis of the Canadian Community Health Survey conducted annually from 2011 to 2016. Estimates for the number of healthcare providers, including social workers, family doctors, psychiatrists, and psychologists, were taken from the Canadian Institute for Health Information. Results show that mental health service use increased significantly. Most people spoke to one provider type about mental health concerns, and psychiatrists have the highest caseload of clients, followed by psychologists in both years. The number of users seen by these providers further increased during this time, yet the number of providers increased marginally for psychologists and not at all for psychiatrists. As such, my first recommendation was to invest in the supply and therefore accessibility of these provider types. Increasing the number of psychologists available is particularly important to increasing accessibility of psychotherapy services emphasized in most provincial mental health initiatives. Second, our results show that social workers have the smallest caseloads, but the greatest increase in number of service users and provider availability during both years. Considering the high supply of social workers, they could be a really important resource to increase mental health service accessibility. To maximize this provider's capability, clear standards of competency for providing psychotherapy services should be established across provinces. Finally, though family doctors have the highest overall rate of service contact in all years, by 2016, social workers and counselors and psychologists were closing the gap in the overall number of users they saw, suggesting a shift in the provider preference among this age group. Considering the national shortage in primary care physicians generally, other mental health care providers may be able to fill this gap through collaborative care. Based on these results, my overarching policy recommendation is to invest strategically in the provision of mental health services based on provider type to maximize effective service delivery. Thank you.
And thank you. You don't need to be surprised that people should be able to pronounce your name correctly. So sorry. Hugh, you should take it away.
Yes, thank you. I really liked your presentation, and I don't know if this is available, but were you able to, or do you know of a data set out there that could also be, integrated into yours to talk about the kind of educational background? You're talking about young adults, so is there anything out there with regards to guidance counselors or teachers or things along that could augment or maybe influence your data?
I really struggled with this. Yes, because from the Canadian, like the CAI data, we have information on social workers, physicians, and psychologists, but the less regulated mental health service providers, such as counselors, were not provided. And there were a lot of limitations to this. I looked at the Canadian Job Bank to look at kind of an idea of, well, how many school counselors are there and how many child and youth counselors are there to kind of inform my idea of caseloads. But this is a limitation, and we're really limited, I think, also continuing on and gathering this data because of that regulation, the lack of regulation between provinces. Like right now, counselors are only regulated in a couple of provinces, I think Ontario included. And this is a very large term that a lot of different mental health providers can use. I really think that, again, all mental health providers are really important in addressing the mental health crisis. And this is where I think introducing these regulations so that we can maximize each provider's utility really comes into play. And hopefully based on regulations, we can also gather that kind of data.
Thank you.
Okay, next up is Umit.
Yeah, definitely. Thanks very much. Obviously, mental health is very important in itself, regardless for all segments of the population. Youth, emerging adults, yes. I guess maybe you're guessing what I'm going to ask, but mental health is also very a culturally loaded concept, right? It's and given that, like, how can one bring into this study of the use of mental health by any population, in this case youth, and also take into account the socioethnic cultural background of both the service providers and of course the clients or potential clients, to better understand that use, and because I mean the use may also not necessarily depend on the availability of services. but it could again go back and relate to more immediate family or cultural group or even neighborhood characteristics. So anyway, it's just probably a similar layer of reality that could help unpack this research problem.
Yes, and I'm so glad you asked that question, because I really think looking at cultural provision of like mental health services based on culture, or providing culturally competent services, are really important and need to be further researched. I did actually look at a separate objective of mine as part of the study, was to look at predictors of service use using Anderson's behavioral model of health services. So through that, I looked at predisposing characteristics, enabling resources, and need for care factors, and using logistic regression models. And so in predisposing characteristics, I did look at ethnicity. And I found some interesting patterns, and I found some stable patterns that really show that we need to have targeted outreach programs for particular groups of people. So in terms of ethnicity, I found that when you compare people who are Caucasian with people who are particularly Asian, of Asian ethnic backgrounds, including South Asians, as well as South and East and Southeast Asians, we found that both South Asians and Southeast Asians are less likely to use services. And this was, again, this is across time from 2011 to 2016, and I'm finding these stable patterns. So I really do think this is an important, considering that this is, again, across time, we're finding stable differences. I think that we really do need targeted outreach here. Because when you look at prevalence of mental health problems within these populations, you do find that there are, like mental health problems exist. It's cross-culturally. So yes, I think that is a very important question. I think another thing that I really like that you asked about was the background of the mental health service provider. This is actually really important for mental health care. Unfortunately, I did not look at that data. I'm not sure that it's even available right now. But there is a need for also increasing not just, again, the number of service providers, but from people of different ethnic backgrounds as well.
Okay, Tammy.
Yeah, I think my questions are very much in line with what Umit was just saying, was thinking about, how people have mental health supports, they need support, and how that can be very different from them actually getting that support. And I just, from casual observation over the past 20 years, that has changed a lot in Canada for everyone, but also differently by groups. So I was wondering first if you can speak to perhaps how the use of mental health supports has changed over time, holding the need constant, for instance. But then also, just from the results that you were showing in your presentation, I'm wondering if there was any big initiatives that might have been happening around 2015-16 that would have pushed people towards using mental health supports more.
Yeah, so that's actually why we were interested. I was very interested in not assuming linearity over 2001 to 2016. So a lot of analyses looking at time frames assume linearity when they're looking at significant differences. I wanted to see if, well, is there a time point where mental health service increases drastically, and if so, then kind of doing a hypothesis testing situation of why that might be. So I did segmented regressions because I did see that increase. And I didn't find that there was a significant, when you compare the segments themselves, like I split up 2011, 2014 with 2015, 2016, and I compared the slope change and I compared the intercepts, and I didn't find a significant difference. So based on that, I couldn't make it, it became hard to say, well, why could this be? So the other part of your question was about holding need constant, how youth may have access to services. So I noticed this increase in mental health services, and I thought, okay, well, there are two possible reasons why mental health services are increasing. We're doing better as a mental health care system to reach people in need, or the prevalence of mental health problems is increasing within youth and emerging adults. So I actually, I compared this two, and I looked at, okay, well, how is need for services? I looked at a more general fair and poor self-rated mental health as an indicator of need for services, which other studies have done. And I found that over time, unsurprisingly, as people have reported, need has increased over time. And then when I compared this and stratified it to, well, how many people who have need for services or are using services, I actually found that there is a stable 2 to 3% of the population across this time who are not accessing services. But I think there's good news and bad news to this. The good news is when I stratified by poor mental health service use, so these are people with extreme need for services, a larger percent of people who report, of youth and emerging adults who are reporting poor mental health are accessing services. I think off the top of my head, the number went from 50% in 2011 to 85% of people with poor mental health were accessing services. However, when I looked at the number of people who had fair mental health who were accessing services, this did not change much across time. So it kind of stayed at like the 50% mark. So I wanted to include this in my policy recommendations. So part of this was also thinking, okay, well, we're doing kind of a good job, kind of treating those people with extreme need for services, but we can't wait till the last minute to provide services to people, because that means further deterioration of mental health, more strain on the mental health care system. We also need early intervention programs that are targeting people earlier so that they have better outcomes.
All right, Claudia.
Great, thanks. These are another one of those big wicked problems that we've been trying to tackle in healthcare. I have two questions, but I'm going to start just building on what you just said in terms of early intervention. So we've been tracking lots of impacts of COVID, and we're seeing, like everybody else, mental health tanking among youth. There's been some variability depending on whether schools are in or out. But I just wonder, a lot of the policy recommendations and suggestions you made are longer term, right? In terms of increasing supply or when we start talking about changing scope of practice, I'm not sure that's a term you used. It's not licensure. Anyhow, those take time, right? So what could we do in the short term where we are potentially seeing, not potentially, we are seeing a growing problem of mental health among youth, to provide those services so that we can avoid, if possible, longer term impacts? So that's my first question. And in that kind of changing need and increasing need, one of the things I didn't see or hear is the role of initiatives to reduce the stigma. So, the Bell Let's Talk. So it's kind of like, it seems that we've reached a point where the stigma is reducing. That's an anecdotal, I don't have evidence. We're getting people more to connect. We know that they're identifying themselves as having mental health issues, but how do we have short-term policy solutions for that? So apologies for the long-winded question, but there we go.
No, that's a really great question. I think that a lot of our healthcare, like across provinces, are moving towards a collaborative care model. And I think this is great. And this is what my policy recommendations are really focusing on. Is it is great to have integrated services by different providers that all of these providers are really important. And we want them to have different roles rather than mixing scopes of practice, so that we can really utilize and provide effective services. So this is where I was really excited seeing that increase in people going to social workers for mental health concerns. We're closing the gap essentially from family physicians, where there is a real shortage in family physicians. And more people are going to social workers and counselors. So I think that this is a great opportunity in the stepped care model to say, well, for early interventions, because social workers do provide psychosocial interventions, coping strategies, they play a number of different roles in helping with mental health. And I think that's where we can really, in the short term, use these providers to provide those early intervention supports and promote mental health. And the next part of your question was about, do you remind me?
Sorry, just the role of efforts to reduce stigma and how that potentially has impacted what we're seeing in terms of increasing need and and people accessing services.
Yeah, so I compared how Canada is doing compared to other countries, and I did find that more people are willing to use services in Canada and speak to a professional than other high-income countries. So compared to US and other European countries, which is great. That you can interpret that as there's less stigma in the Canadian population, it seems. But also a fair amount of people said, well, even though I want to, I can't access care. And so we're reducing stigma, but we're not increasing access. And as Umit pointed out, there are also cultural differences and stigma related and, to mental health in particular cultures. And this is where I really wanted to look at predictors of service use to talk about increasing, targeted outreach programs that provide both psychoeducation to reduce stigma in certain groups of people and also increase access to certain groups of people. So I think that is also a really important thing to consider as well.
Okay, Monica, go ahead. And Thipiga, I'm sorry, I'm gonna have to ask you to keep your answer brief on the last one. No problem, no problem.
Oh, great, because I had a long question that I wanted to ask. I think the biggest part for me, and again, having teenage children, very near and dear, especially during times of COVID. But, one of the things to look at, and I'm not sure if you've thought about looking further into data sets on education, even the criminal side, because there are other care providers, and, Claudia, you touched a bit on that. Are you able to look at, it's kind of a two-pronged, but look at those data sets. So look at truancy, look at early intervention as far as 911 calls, because a lot of those calls there could be things avoided as well on the criminal side if there were mental health services available to those that need them and help prevent, like this is a huge investment that be able, cost avoidance down the way. And I'm talking about the extreme, but from an education perspective, looking at truancy and starting to understand, educators probably can understand at a grade 3 who is going to have those troubles. So I'm just wondering if you've given some thought into using data sets from either education or in the criminal side.
I can be honest with you and say that I have not, but I think those are really important questions to look into. I think here, again, early intervention to target those that might have more behavioral issues as kids, and how we as teachers interact with these kids to produce more positive outcomes, or like other supports that we can provide for these children to have more positive impacts down the line is really important. And it's definitely something that future research should look at. I'm trying to keep my answer brief.
Well, that's okay. We'll have some more time at the end of the day tomorrow if you and Monica want to expand on that. So we've come to the end of our program for today. I'm just going to get the judges to fill out their forms when we sign off, but this is where I'm supposed to make my closing remarks for the day. So I just want to say super impressed with everything I saw so far today. You guys did an excellent job. We'll be back here tomorrow. If you were paying attention to the schedule, not to point any fingers, but we did have a student who unfortunately had to withdraw. So we offered his place to Anil Arora, chief statistician, who graciously accepted to speak a little bit to the group. So we'll have that for you at the start of day tomorrow. But overall, super job, everybody. Thanks for all the great questions from the judges. Thanks for all the thoughtful answers from the presenters. And we'll look forward